A balance disorder is a medical problem that makes you feel unstable or dizzy. Standing, sitting or lying down, you may feel like you are moving, floating or spinning. If you are walking, you may suddenly feel like you are going to fall. Everyone feels dizzy from time to time, but the term dizzy can mean different things to different people. For one person, feeling dizzy might mean a brief feeling of weakness, while for another it might be an intense feeling of spinning, vertigo, that lasts a long time. We are talking about a disorder that affects approximately 15% of the population, which can deeply affect daily activities, as well as cause psychological and emotional problems. Symptoms of a balance disorder may include dizziness or vertigo, feeling that everything is spinning, fall or feel like you're going to fall, stagger when you try to walk, feel like you're going to fade or pass out, or have a feeling of floating, blurry vision and confusion or disorientation. There may be other symptoms, such as nausea and vomiting, diarrhea, changes in heart rate and blood pressure, and fear, anxiety or panic. Symptoms may come and go for short periods of time or last a long time, in which case, they can lead to fatigue and depression. Causes of balance problems include certain medications, ear infections, head injuries, or any other condition that affects the inner ear or brain. Low blood pressure can cause dizziness when a person stands up too quickly. If he or she ends up fainting, he or she has vasovagal syncope. Problems affecting the skeletal or visual systems, such as arthritis or an imbalance of the eye muscles, can also cause balance disorders. The chances of having balance problems can occur suddenly and without apparent cause, but those chances increase with age. The sense of balance is based on a series of signals that reach the brain from the eyes, ears, and the muscles and touch sensors in the legs. The part of the ear that helps with balance is known as the vestibular system, or the labyrinth, a structure in the inner ear made up of bone and soft tissue. Inside the labyrinth there are structures called semicircular ducts, arranged at right angles to each other. The liquid inside moves when you turn your head and impacts against the gelatinous structure at the ends of each loop, called the dome. This dome curls and flexes like sails in the wind. These movements are picked up by specialized cells and converted into nerve signals that go to the brain. This is how we know which direction the head has turned. Following the semicircular ducts are two organs, the utricle and the saccule, which are like bags of fluid. This fluid contains tiny, dense crystals of calcium carbonate, called otoliths. No matter what position your head is in, gravity pulls them down, so any movement will cause the cells lining the inside of these organs to detect the movement of the otoliths. When one moves, the vestibular system detects gravity and other mechanical forces, which stimulate the semicircular canals and the otolytic organs. Their signals join those from the eyes and the musculoskeletal sensory system to control the position of the body at rest or in motion. This allows you to maintain a stable posture or keep your balance when walking or running. It also helps to maintain a stable visual focus on objects when the body changes position. When the signals from any of these sensory systems malfunction, dizziness or vertigo appears. If you also have problems with motor control, such as weakness, slowness, trembling, or stiffness, you may lose the ability to regain good balance. This increases the risk of falling and injury. There are over a dozen different balance disorders. Some of the most common are benign paroxysmal positional vertigo, BPPV, a brief but intense episode of vertigo caused by a change in head position. You feel everything spinning when you bend over to look for something, look up or to the side, or roll over in bed. This vertigo occurs when some loose otoliths, the calcium carbonate crystals we said before, fall into one of the semicircular canals and prevent the dome from bending correctly. This causes incorrect information to reach the brain about the position of the head, which causes the vertigo. It may be the result of a head injury, or it may occur simply by aging. Labyrinthitis, an infection or inflammation of the inner ear, causes dizziness and loss of balance. It is often associated with an upper respiratory infection, such as the flu. Meniere's disease is characterized by episodes of vertigo, hearing loss, tinnitus, a ringing, whistling or buzzing in the ear, and a feeling that the ear is full. It may be associated with a change in the volume of the fluid within the parts of the labyrinth, but it is not yet known what causes it. Vestibular neuronitis. This is an inflammation of the vestibular nerve which can be caused by a virus and which mainly causes vertigo. Perilymphatic fistula consists of fluid leaking from the inner ear into the middle ear. It causes instability that often increases with activity, as well as dizziness and nausea. It can occur after a head injury, dramatic changes in air pressure, such as when diving, physical exertion, ear surgery, or chronic ear infections. But some people are also born with a perilymphatic fistula, landing sickness syndrome, usually after a cruise or other sea journey, or even after running for a long time on the treadmill. The symptoms usually go away within hours or days of going ashore or stopping the treadmill. However, more severe cases may last for months or even years. The cause remains unknown. Well, that's it for today. We have yet to see how a balance disorder is diagnosed and what to do from there. Thank you very much, and until the next video.